Starting from scratch, easing eczema and soothing sensitive skin. The purpose of this program is to provide information about basic skin care for people with eczema and sensitive skin, including the safest and most effective ways to bathe and moisturize.
What worked for us was soaking her in warm, not too cold, not too hot water.
Everyone knows that the goal of healthy eating is to maintain a healthy body. Likewise, the goal of healthy skin care is to restore and maintain a healthy skin barrier.
I use moisturizer every time I take a shower, so every day, at least once, and then before going to bed.
Armed with this knowledge, eczema sufferers and people with sensitive skin can enjoy the skin they're in.
It doesn't have to take over your life, and you can just live life the way you're supposed to.
The content of this presentation has been developed by the National Eczema Association and Dr. Elaine Siegfried of the St. Louis University School of Medicine, and is generously sponsored by the Vaseline Skin Fund. The information in this program sets forth current opinions from recognized authorities, but it does not dictate an exclusive treatment course. If you have a specific question about your medical condition, please see your doctor. What does it mean to be comfortable in your own skin? For most people, it's accepting who you are. But for people with eczema and/or sensitive skin, the meaning is quite literal. Hard-to-manage itch and chronic red rashes make people want to jump out of their skin. More than 30 million Americans have a chronic form of eczema, including up to 20% of children and 3% of adults. That is 2 to 3 times the number of people who had it 30 years ago. 1 in 10 people with eczema have severe disease that drastically impacts their quality of life. To better understand what eczema is and how to care for sensitive skin, we spoke with Dr. Elaine Siegfried, a recognized authority on eczema and associated skin disorders. What is eczema?
The skin is an amazing organ. It contains sweat glands, blood vessels, and nerve endings, and has the ability to regulate body temperature. Healthy skin's like a suit of armor that protects the body from infection, irritation, and drying out. There are 2 main layers, the outer epidermis and the inner dermis. The epidermis is the body's main barrier against the environment. The dermis provides structure and support. The topmost layer of the epidermis is made of rows of flattened protective cell parts called the stratum corneum. The most important differences between healthy skin and sensitive skin are in that stratum corneum.
Healthy skin cells contain water. Proteins and oils in and around the cells help hold on to this moisture. A healthy layer of cells forms a protective barrier, supporting growth of good germs and preventing other substances like poisons, allergic triggers, and harmful germs from getting through. Sensitive skin is often the result of an inherited flaw in a vital skin protein, resulting in a weak stratum corneum that's unable to hold moisture or normally replace worn-out cells. Gaps form between dehydrated cells, allowing moisture loss from the deeper layers of the skin, and also allowing harmful germs, toxins, or allergenic substances into the skin.
Both terms, eczema and dermatitis, describe skin that's dry, flaky, red, easily irritated, and itchy. There's several forms of eczema, but atopic eczema, also called atopic dermatitis, is the most persistent form. It almost always starts in early infancy and can last for many years. Atopic is a strange medical term describing a variety of allergic conditions that run in families. Hay fever, asthma, and eczema are all examples of atopic conditions. These conditions are caused by a combination of both inherited and environmental factors, although it's still not known exactly why they develop in some people and not in others. The most well-known features of atopic dermatitis are the nagging itch, the interrupted sleep, the confusion, and the frustration that comes with hearing so many conflicting pieces of advice and trying so many different products that just don't seem to help. Atopic dermatitis can't kill you, but it certainly can seem to ruin your life.
Eczema is not easy to live with. I sometimes feel resentful that I've had to deal with this, why me? I've tried everything to relieve the itch, the rash, which has kept me up countless nights, and it has been really uncomfortable during the day too. Even something as ordinary as changing the clothing I wear can trigger a flare-up for me. Wool fabrics can be extremely problematic for me, so I usually wear cotton, which is the material that feels the best against my skin. A good cleansing, moisturizing regimen would be a very important key regimen to learn. I always choose the cleansers that are mild, fragrance-free, and then I moisturize after bathing immediately.
What are the best ways to manage triggers and avoid flares?
Eczema often has a roller coaster pattern of flares and remissions, when the rash gets worse, alternating with periods when it's calm or even completely cleared. The reason for it getting worse aren't always obvious. Factors that worsen eczema are called triggers. This chart lists common eczema triggers. Different people have different triggers, and one person often has more than one trigger. An important step to controlling eczema is to recognize and then avoid relevant triggers. This can be a challenge. The most straightforward approach is by process of elimination. Some triggers are common, others are rare. It's easy to steer clear of some, while others are impossible to avoid. It's always simplest to start by managing common triggers that aren't difficult to eliminate or control. These include dry skin, contact irritants, or contact allergens.
What are the basics of bathing and moisturizing?
The two most important ways to care for dry, sensitive skin are bathing, followed by application of a bland moisturizer. You just learned that skin affected by eczema can't hold moisture well. Remember the stratum corneum. So the important goal of keeping moisture in the skin should make sense. The best way to put moisture in the skin is by soaking in water, keeping a few important rules in mind. Never soak without applying a moisturizer. Frequent wetting and drying without moisturizing will actually have a drying effect. Use cleansing products sparingly. Most cleansers strip oil and surface cells from the skin, but skin affected by eczema breaks down more easily and quickly and becomes irritated, cracked, and inflamed. Bathing also removes dead skin cells and germs and is a great way to relax. The optimal duration or frequency, or the advantages of a bath compared to a shower, haven't been well studied, so personal preference also counts. Most dermatologists recommend taking at least one bath or one shower per day for no longer than 5 or 10 minutes, with warm but not hot water and no scrubbing. You can add a small amount of bleach to a bath to help control germs. It's kind of like a swimming pool. Ask your physician how much bleach to add. Some people like other bath additives, such as finely ground or colloidal oatmeal, or salts like pickling, kosher, Epsom, or Dead Sea salts. Before you try any of these bathing techniques, ask your doctor for specific recommendations. Using the proper amount of an additive will help you get the result that you want. Find additional information at iseczema.org. Remember, when choosing a cleanser, that soap is made from lye, so it's alkaline and may irritate sensitive skin. Liquid cleansers and non-soap bar cleansers are less irritating. Choose a gentle cleanser that's mild and fragrance-free with as few ingredients as possible to avoid potential skin irritation. You can find a list of ingredients to avoid on the Is Eczema website.
My daughter Katie was diagnosed with eczema when she was just 3 months old. When that happened, there was a lot of things we had to change. We had to change our lifestyle to be more careful about the potential triggers we might have around the house and certain clothes we bought for her. We also had to change our bathing routine. Soaking her in warm water, not hot and not too cold, helped her. And sometimes when it was really bad, soaking her in oatmeal really helped her with her itching. We used like a mild cleanser to wash her, and then we wrap her in towels. Afterwards, we'll take her and then moisturize her from head to toe. since we made minor changes here and there, she's much more happy and, and she's not suffering anymore.
The best way to put water in the skin is to briefly soak in the bath or shower. The best way to keep water in the skin is to moisturize immediately after bathing.